here in San Jose, Costa Rica, and we were thinking of which would be the simplest way to assess all the different scallops through 2D transesophageal echocardiography without having to go into the gastric views and without having to do 3D images. This is mainly because it's important that we first understand 2D imaging, and secondly, in this pandemic, we probably don't have much time to be assessing entirety and in a exhaustive manner. So this is mitral valve scallops made enjoyably simple for dummies. So there's two methods. Choose one of the two and use it. Excel at it and then add upon your craft, So this image was taken from the Journal of American Society of Echocardiography 2002. We'll base ourselves on this image and we'll take all the learnings from this. We'll go into this. We'll dive into this. At first, it looks pretty complicated, but we'll see how it will be made pretty simple. So this is the probe. This is the echocardiography probe. And look at the illustration B. You can see the different sections where this probe is. So you have upper esophageal, you have mid esophageal, and you have transgastric and deep transgastric. On illustration A, you can see the different movements the probe can actually do. In general, we are taught the probe has 6 different movements. I'd like to say there's 8. Why? Because I'm including the up and down movement. So you withdraw or advance, those are 2. You turn clockwise, which would be to the right, or turn counterclockwise, which would be to the left. You have 4. Then you can rotate the ultrasonographic assessment beam, but that's the degree. The degrees that's not seen as a movement, at least a physical movement of the probe. That's the movement of the crystal orientation. Then you have anterior and posterior, which would be antiflexion and retroflexion. So if I was the patient, antiflexion, retroflex. Then you have right and left, okay? So in general, 8 movements. We'll use these movements. We'll try to move the probe the less we can and use the least amount of views necessary to assess the different scallops of the mitral valve. So method number 1, start from 0. What do we mean by this? Start mid-esophageal, 0 degrees, and just go up and down. That's it. You can assess all the scallops from 0 degrees, mid-esophageal, going up and down. So here we have the illustration. Here you can see on the left side where the probe is into the esophagus, and that would be 0 degrees. And you can see, imagine how this is cutting the heart. So if you have the heart like this, and you're slicing it like this with the ultrasound beam, you're getting, this is open. So let's look at it from the bottom. You have the 2 atria and the 2 ventricles. So that's why 0 degrees is 4-chamber view. So on the right, you can see the same thing, just that now you are inside the patient and right behind the probe. You're seeing exactly where this ultrasound beam is cutting. It's cutting the tissue, the heart, like this. So what are you gonna see? You aren't gonna see an image like this. You're gonna see you slice this up like this. So you're gonna see this portion open like this. Okay, so look at the mitral valve on the right, this right figure. You can see the mitral valve where it is sliced, and it is sliced right in between. Remember that the two scallops that are right in between the mitral valve are A2 and P2. So you have 6 scallops. A is anterior, P is posterior. You have 1, 2, and 3 for each. So how did I learn this? The scallops which have a 1 are more kind of lateral. They're more kind of, remember that the image is inverted. What you see on the screen is inverted to what we're seeing on this anatomical images we have in this superior portion. So you can see that A1 and P1 is closest to the left atrial appendage. A3 and P3 is furthest away from this, and it would be more in close contact with the inner ventricular septum per se. Okay, so look at the inferior to the right image where you can see the, I erased everything which isn't important right now. We're talking about 0 degrees. So look at the circle in green where you have A2, P2. Why are we seeing A2 and P2 scallops? If you see the line that is crossing the mitral valve at 0 degrees, those are the 2 scallops that we view. So you understand this better, look at the image right above this, and you can see how the ultrasound beam is passing right across the middle of the mitral valve. So A2, P2 is 0 degrees or 4 chambers. This is the base of this method, remember? 0 degrees. Now, what will you do to assess the rest of the scalp? You will just do 2 movements. Withdraw, or you will introduce the probe a little more. Not right, left. You don't change degrees, just up and down. So what happens if you go up? If you go up, look at the image on the left. You can see upper esophageal. That is a little too high. We don't want to go that high. We just want to go a little higher than mid-esophageal. Right above mid-esophageal, you'll see the aorta. Why? Because we're getting closer to the superior portion of the heart. So you'll see the aorta. When you see the aorta, it's 2 things. You are more superiorly oriented, and you also know what is anterior and what isn't anterior. So what is close to the aorta is anterior. So let's look at it with this drawing. We already saw mid-esophageal, which is represented here in yellow. Now we're gonna see what happens if you go up or down from 0 degrees or 4 chamber view. There you have it. There you have the basis, A2, P2, 4 chambers. Here, now we're moving the probe higher up, the green line. See, you're still assessing at 0 degrees, but you're higher. When you're higher, what will you see? What's higher up in the heart? What's higher up in the heart? The left atrial appendage or the interventricular septum? It's the left atrial appendage. That's why you'll see A1, P1. Okay? Now, let's introduce the probe a little more. Always 0 degrees. Here you have this blue line, 0 degrees. What will you see? The 2 scallops remaining, A3 and P3. In general, let's see. And now we'll see this with this Cine loop. Okay? So right here, we're seeing the mitral valve. Well, it just moved a little. First, it was A2, P2 when you're seeing 4 chamber view. But look at it right here. Here we have A2, P2, but now there's the aorta. Then we withdraw it a little, we're seeing A1, P1, A1, P1, okay? And we have A1 there and P1 here. Now we're seeing A3 and P3. This is when we introduced the probe a little further into then the mid-esophageal portion. Now let's go on to the second method. That was the first method. Look how simple it is. We'll see it again. Let's look at it again. We have to go through this fast. Change, wait a second. Okay, here you have it. First, A2, P2. Here you have A1, P1. And next, which should be P1, A1. Next, you have A3, P3, which would actually be P3, A3. You read this from left to right. That's why, see how I just got confused here. In general, read this left to right, and you usually start off with the P. That's why we will see that in method 2, in the second method, there's a mnemonic which starts off with the letter P. Then don't get this confused. You can see how I just got it a little confused. Okay, we have to practice. Practice makes perfect. This is method number 2, okay? In method number 2, we're gonna change the view. We're always in mid-esophageal portion, and now we change the angle. We change the degrees in which these crystals are oriented. What is the degree we have to choose? Let's go to 60 degrees. Around 60 degrees, it depends, but average around 60 degrees. What is the image you want to see? You want to see the bicommissural image. This isn't 2 chambers yet. 2 chambers is 90 degrees. 60 degrees is bicommissural. And bicommissural means you can see these 2 commissures. And it makes an interesting sign. You can usually see like 3 here, P3, A's here, usually A2, A1, and here, P1. We'll see it in the next image. So this is the mnemonic for the second method. The second method is bicommissural, and once you're there, you remember this mnemonic. When you see 60-year-old puppy, don't forget to look left and right. Okay, let's think this over. Puppy, what does puppy mean? Puppy is something probably any Spanish speaker understands puppy, which means dad or daddy. So we're looking for a view which tries to encompass everything, a base in order to assess the rest. So what better than choosing daddy or mommy? In this case, the mnemonic works out with choosing the word puppy. What does puppy mean? P-A-P, and the I for puppy is actually a 1. The Roman numeral for 1 looks like a capital I, so we use it as puppy. What's the importance of this mnemonic? Because in bicommissural view, 60 degrees, you'll see puppy, P-A-P, and what's that I? It's a 1. So where's the 3? The 3 is here. 3, 2, 1. P3, A2, P1, puppy. Why didn't this mnemonic go become P3, A2, P1? Because it's boring and you won't remember it. It's puppy because you can remember this word, puppy. You'll just ask yourself, why was it puppy? I have P, A, P, and what's the I? The I is a 1. You're reading from left to right. P3, A2, P1. So now you know that in bicommissural, you have those scallops. sometimes the middle, the A might be, instead of A2, it could be A1. And in some scenarios, it might even be a little of A3. But remember this mnemonic. So what will you do after you're in bicommissural? You'll just rotate the probe clockwise or anti-clockwise. Clockwise is just a fancy name, fancy name for right. You have the probe, you're going right. Why? If you turn it right, either proximal or distally, right? The probe is here. If you turn it right, it will look over there. What do you think it will look at? This side, more medial or more lateral? Probably right is more medial structures in the case of the heart. So if you rotated it clockwise, you'll see the anterior mitral valve, because look at the ray. I hadn't spoken of this. Look at this image right next to this box. Look at the image, and you can see this ultrasound beam, how it's crossing the mitral valve. You can see that bicommissural crosses the mitral valve, and that's why you can see these two commissures, because you have the mitral valve in this disposition. It's not like this, it's like this. And you have the little, let's see if I can make it here. This is the mitral valve, okay? And this is the disposition. What is my pinky finger? It's the it's the opening for the mitral valve. So right from that, you'll see the anterior, and left from that, you'll see posterior. So if you rotate to the right, you'll see anterior. Then what's the way to learn this? Let's look at this animation. We'll see it, right? I think it didn't show up. Didn't show up. Okay, let's look at this this cine loop right here. Here you have puppy. Down left without Doppler collar, down right with Doppler collar. See? P3, A2, P1. Okay, now you're gonna rotate to the right or clockwise, and you'll see how this will change. Let's see, but not yet. It's just showing you the bicommissural. Okay, here you have clockwise. In the end, let's look at it right here. Gonna go backwards. Okay, here you have clockwise, always 60 degrees. Go clockwise. What are you seeing? All the anterior. You're seeing A3, A2, A1. Now, if you go anti-clockwise, what will you see? The other three scallops. So let's look at it here. Okay, this is the illustration I was talking about. See how it rotates? Then let's see it again. Let's give it a second so it pauses. See, here we have only the image I want you to fix yourself upon, which is bicommissural. 75 degrees, right here it says 75 degrees, could be 75 or 60 degrees. It's passing through the two commissures. So that, what are we seeing right here? Puppy, P3, A2, P1. Now, if you rotate the probe clockwise, this is what's gonna happen. Look at the probe rotating clockwise. See? What are you gonna see if it rotates clockwise? You'll see anterior. Why? Because of this other explanation. Here we have an analogic clock on the left, and anyone that has used analogous or analogic clocks know that the what's the name of this? Well, time goes in a clockwise manner. That's why it's called clockwise. So clockwise means you're going in front of yourself. So anterior. So, and if you could compare this to posterior and anterior, what is in the future, whatever is anterior or in front of you. That is why clockwise movement will make you see anterior scallops, A3, A2, A1. Anti-clockwise movement will see P or posterior scallops. This is why I'm showing you guys this mnemonics down here with this fork I didn't actually use. And here you have the mnemonic. Anti-clockwise is P for posterior and P for past. So if you can make the hands in the watch, in this analogic watch, go backwards, you're looking at the past. You're looking to the P posterior, past with a P for posterior. And how will you read this? 3, 2, 1. From left to right, 3, 2, 1. And I think that would be it. So this illustration right here is showing you clockwise, and now they're gonna change it to counterclockwise or anti-clockwise. See, now it's anti-clockwise. And right here, it's P3, P2, and P1. So in this image, you can see clearly that the scallop in charge of the mitral regurgitation, the scallop that had a prolapse was scallop P3. Why? Because I'm showing it here to you with the mouse. I guess you guys could see the mouse. Don't know why I didn't think of this earlier and was doing all these strange signs. I pardon. I ask for forgiveness for that, and I pardon myself as well. Okay. So, thing is that look at it right here, P3, and that's it. A long video for something which is very simple, but if I brought this, if I landed this idea on you guys, you can't erase it. You won't erase it, and you'll always know how to assess all the mitral valve scallops in a simple manner without thinking of extremely complex ways. Remember that when we have to go in pilot mode, when we have to think fast, when we have to just assess things urgently, we don't have time to start messing around and going into complexity. So that's it, guys. Let's stop this share and hope this helps someone. Sorry for my Spanish. I don't use it that much, but we're working on it. In meeting for all.